All right, welcome to Virtual Face-to-Face with President Bruce Gerald. I'm Alex Lakowski, Executive Director of Media Relations. Today we are 55 days into the new year, and in that brief time, according to Baltimore police statistics, more than 3,700 violent crimes have been reported in the city. They included 102 shootings and 51 murders, and if that keeps up at this rate, 2022 will see the highest murder rate since 1993. That is a terrible reality for the victims of homicide and their families, but living as the survivor of violent crime is also very difficult. For most, the crime itself is just the beginning. A Department of Justice study reports two-thirds of violent crime survivors suffered social, emotional, even physical problems as a result of their victimization, including, the study says, feelings of moderate to severe distress, significant problems with work or school, such as trouble with a boss or coworkers or peers, or significant problems with family members or friends, including more arguments than before the victimization and inability to trust or be close to anyone. Those are symptoms that may last for months or even years and lead to more problems like financial or legal trouble. Sadly, the DOJ also says more than a third of the victims who were severely distressed did not report the crime to police or receive any kind of assistance. And even among those who did report the crime, only about half got any help after they made that report. Now, that lack of reporting is largely because most violent crime takes place in disadvantaged and underserved communities where residents often fear the police or fear reprisals if they cooperate with them. They even fear losing their property sometimes, which may be taken as evidence after the report of a crime. And many of the victims are new or undocumented immigrants, people experiencing homelessness or substance abuse disorders, or even mental health disorders. So they are often not inclined or well equipped to navigate the bureaucracy that they would face after a crime report. For 3 years, ROAR, the Rebuild, Overcome, and Rise Center, has been helping survivors of violent crime in Baltimore keep from being re-victimized as they try to get their lives back on track. Launched in early 2019, ROAR is the creation of our own Francis King Carey School of Law. There are lots of ways in which victims of crime are not served by the existing system, says our own law dean, Donald Tobin. You might need help with your housing. You might need help finding medical benefits because you're injured. You don't know where to turn. You might need counseling and support. Well, whatever the need is, our guest today, ROAR's Executive Director Lydia Watts, has described the center as a sort of one-stop shop where crime survivors can access a wide variety of services in a safe and comforting environment. Now, what's more, ROAR clients can get help even if they have not, for whatever reason, reported a crime to police. The ROAR team includes lawyers and social workers, even a registered nurse, and the center partners with dozens of service organizations around the city. Last fall, ROAR was singled out for its accomplishments as Mayor Brandon Scott announced his intent to spend $50 million in federal American Rescue Plan Act funding on violence prevention efforts and victim services. And last week, the mayor and his Office of Neighborhood Safety and Engagement unveiled the first recipients of that funding, and ROAR will receive a $1.5 million multi-year contract to help continue its work. Well, joining Dr. Gerald today is the aforementioned Executive Director of ROAR, Lydia Watts. I need to remind you that this program is being recorded and for posting later on the UMB homepage. And later in the program, you'll have a chance to ask your questions. Find the chat button, write your question there, and let me know if you want to remain anonymous. That's okay. When the time comes, we'll call on you by name and I'll open your mic for you. So all you have to do is speak up. Now, welcome your host, UMB President, Dr. Bruce Gerald.
Thank you, Alex. It's a pleasure to be here, and I'd like to welcome Lydia to our group here. It's nice to have you participating with us. I look forward to an interesting discussion because this is a really relevant topic, particularly to Baltimore City. But before I get to there, maybe I want to ask a first question. Most of us don't know who the Department of Justice is, and we also don't know why the Department of Justice is putting money into this kind of program. Can you give us just a little background and insight into who they are and why they're doing this? You're muted.
That is troubling. So the Department of Justice is a federal agency tasked with many different pieces of what a layperson may think of as the justice systems. But one office within the Department of Justice is called the Office of Victims of Crime. There's another that's called the Office of Violence Against Women. And those offices, both of them, have a variety of funding streams that are monies appropriated by Congress, and some of which go directly to organizations and some that go to each state. So ROAR's funding is a combination of quite a bit of DOJ, Department of Justice funding, some of which comes through the governor's office and some of which comes directly to ROAR. Other people in the city may know the Department of Justice for things like the investigation into the Baltimore Police Department. So both the consent decree that oversees changes to the Baltimore Police Department is overseen by the Department of Justice. The recent gun trace task force investigation was done by the Department of Justice. So they have their hands in lots of different pieces, again, of the justice system that includes lawyers, but also includes other pieces, law enforcement, border control, many different aspects of the federal government's operations.
Thank you. And again, since most of us don't know about DOJ, at least let's hope so, most of the time, my question really then became, they put out these requests for proposals. I know you weren't here at the time, but what kinds of programs are they looking for, Lydia, and how did this one come to be?
Sure. So the original funding that came to ROAR, that created ROAR, is called the Victims of Crime Act, or VOCA is how it's often referred to. So many acronyms. VOCA is actually an act that was passed in the 80s, and it is very much focused on exactly what the title suggests, victims of crime. So VOCA funds, again, flow from the Department of Justice. This is what is referred to as a block grant, which means that there's a certain amount of money that each state gets, and it's goes up and down depending on the population of the state, which is one reason why the census count is so important. And so this in Maryland, the entity that receives that fund is the Governor's Office on Crime Prevention, Youth and Victim Services, formerly known as GOCAP. It's the acronym no longer works out to GOCAP, but everyone still calls it GOCAP. So GOCAP is the entity in the Governor's Office that then subgrants that money from the federal government to organizations such as ROAR. So VOCA funds do go to law enforcement, they go to prosecutors' offices, and they go to entities that are typically nonprofits, but they can certainly be a center at a university such as ROAR that is providing direct services to victims of crime. So a lot of funding goes to services for survivors of intimate partner violence, survivors of sexual assault, survivors of human trafficking. What makes ROAR unique, really, in the country, I mean, we're not the only ones in the country, but it's much fewer, that we work with survivors of all types of crime rather than just one type. And there's a variety of reasons for that, one of which is, unfortunately, the lived experience of many people, particularly those that may also be in the groups that Alex mentioned at the beginning, undocumented immigrants, people of color, people living in poverty, people experiencing homelessness, people struggling with mental health issues or substance abuse disorders. All of the, any number or combination of those identities that somebody might identify with places folks at higher risk of being victimized, and often people are victimized many times over their lifespan. The lingo behind that is called polyvictimization. So ROAR, in recognition that folks are often experiencing maybe child abuse, and then maybe intimate partner violence later, maybe gun violence at some point in their life, that they don't think of themselves as, I am a survivor of a particular type of crime, but rather that all of those impacts that Alex mentioned in his introduction is something I'm experiencing. I feel distrustful, I feel anxious, I am not able to work, and I'm having all of these collateral consequences as a result of that original victimization, or plural, multiple victimizations.
So how do you identify your clients, and tell us sort of what your office does for them?
Very much word of mouth. As Alex said in the introduction, we've only been in existence for 3 years. We've been fully staffed, or our sort of initial wave of staffing was June of 2019. So we had less than a year under our belt before we went on lockdown because of the pandemic. So in those first months that we were open, we did a lot of face-to-face meetings with organizations that work with the populations that I mentioned that are at highest risk of being victimized. So we reached out to those pre-existing, both on campus as well as throughout the city. That was a lot of how we got the initial referrals, was reaching out to the House of Ruth, Maryland, that works with survivors of intimate partner violence, reaching out to Turnaround, that works with sexual assault survivors, reaching out to Healthcare for the Homeless, or the Homeless Persons Representation Project, other legal service providers, the police, the state's attorney's office, all of the people that we know, also our campus police, that we know are often interacting with survivors of crime. Some of those that I named already have services in place, and so sometimes it was us complementing what they have, and other times it was we really don't know where to send people when they're struggling with X issue, and so it's great to know you exist. So that was initially, it was a lot of outreach. Now, a lot of it is word of mouth. I would say our number one referral source are hospitals, where, again, if somebody is, of course, injured, then, hopefully they go to the hospital to get treatment for those physical injuries. And then there at the hospital, people are often referred to us either post-discharge or even sometimes when they're still in the hospital, depending on what their needs might be.
Right, and so you've got a fairly well-established office now. How many people do you have, and what kind of services can they provide?
Sure. We have 12 folks working here at the moment, 8 full-time, 4 part-time. We're in a cycle of hiring because of that, the funding that Alex mentioned that we are getting from the mayor's office. So we'll be to 20 soon. And the types of services that we provide, we have lawyers on staff, social workers, and an RN, and then we have also some support staff. So the types of services, I usually describe this with a fictional survivor of crime. So we'll call her Teresa. So Teresa's been referred to us. Her 19-year-old son was murdered, and she is struggling with grief and trauma related to the murder of her son. So she may come to us first, quite literally, with grief and trauma, needing to talk to a therapist. As one can imagine, oftentimes that level of loss can really lead to people not being able, feeling unable to kind of maintain their daily life, right? So this fictional Teresa also has younger children, and she's having a tough time getting the kids off to school. Maybe she's having a tough time going to work, and she's at risk of losing her job. Or maybe she's already lost her job, and now she's not able to pay her rent, and she's at risk of eviction. Maybe her younger kids who have also, lost their older brother to a violent crime are having a tough time with school. Maybe they're truant. Maybe they're tardy all the time, or having performance issues in their schooling. So you can see the way in which that obviously horrific event of the murder of the 19-year-old son reverberates through the family. So it's very, we call ourselves survivor driven. So it would be entirely up to Teresa to decide, what do you want from us and what first? So again, maybe it's therapy first, but now I'm about to lose my job, and it would be great if a lawyer could be in touch with my employer. Maybe there are some laws that apply, depending on who the employer is and the number of employees, that we could try to get accommodations for Teresa so that she doesn't lose her job. Or maybe she's already lost her job, and so she needs help finding another job. Maybe she needs some respite because of all that she's going through, and so are there some financial benefits that she might be entitled to that can help float her while she's grieving, going through those initial early months of very intense grief, and we can help her, not lose her apartment. Maybe she's in eviction proceedings, and we can try to negotiate with the landlord. So you can see the ways in which all of these different professionals can come in to assist Teresa. I'm now going to add on to Teresa's story that she also is diabetic, and in that period of intense grief, she's not monitoring her insulin levels, and she's now having, going into diabetic shock or having other issues with her health related to her unmonitored diabetes. And she's fallen out of care. She needs to get back into care with the appropriate specialists. And so we also have an RN on staff who can help with all of those issues, both with chronic health conditions, but also with the injuries that may be resulting from the original victimization. About 40% of the folks who come to ROAR are survivors of gun violence, and the vast majority of those are survivors of non-fatal gunshots. So these, as you probably know, there's roughly 3 times the number of people shot as murdered every year in Baltimore City. This is true across the country. So when we're looking at 300 plus people being murdered, 360 some last year, it's over 1,000 who are non-fatally shot. And I mentioned that at this juncture because obviously those folks have some pretty significant medical issues, depending on the severity of the injury caused by the gunshot. But some of them, are in wheelchairs or are not as mobile as they once were. They certainly have wound care, they have pain management. Sometimes they've had other systems. We have many people that have colostomy bags as a result, and so there's all sorts of medical needs. And that the most common scenario of a person shot in Baltimore City is a young Black man, and so they may not have much experience navigating our complex health system, where you need a referral from this doctor to go to this doctor. And so our nurse care manager has been very, very critical in filling that gap of when somebody is discharged from the hospital, they're given, of course, a whole stack of referrals for all of those medical needs. But it's to somebody who maybe doesn't, hasn't had to navigate this before, or typically young, typically haven't had health issues in the past. And so it's all sort of a very foreign environment. So our nurse has been really critical in helping folks in that kind of scenario who have those acute medical needs and maybe chronic, really kind of adjust to those needs and get the care they need to heal properly and achieve mobility or whatever might have been impacted by the gunshot.
Thanks for that. And for our audience, I want to remind you that please put your questions into Alex so we can have our expert here address them. In listening to you describe all this, Lydia, what comes to mind is there's an awful lot of victims in Baltimore, and you're seeing a handful. You can define what a handful is for me. And the main method here is word of mouth or self-identification of the need for help or intervention. It seems like that's a tip of an iceberg. Well, what's kind of your view on that one?
Yeah, you're absolutely right. There is far greater need for the services that I've described than there is capacity to meet that need. So handful, we help roughly about 250 to 280 people, unduplicated people a year. Some of those folks, it's a fairly minimal. They just need some information about particular question they might have. Again, I'll use Teresa as an example, this fictional character who maybe wants to know what's happening with the police investigation. Have you found out who's killed Teresa's son? We want to know. I want to know. I'm Teresa. I want to know who killed my son. And so sometimes it's a relatively simple question of connecting with the Baltimore Police Department, trying to find out who the detective is on that case, trying to get an update. I say that as if it's easy. It's actually quite, it's a pretty bureaucratic system to try to get that information. There are advocates at the Baltimore Police Department, so sometimes it's connecting them with those advocates so they can get that information. So sometimes it's a fairly time limited. Maybe that's all that Teresa wanted. She wants to hear from the detective, and she's got her other needs met. Maybe she has family or other things that are supporting her. And sometimes, as I described, Teresa has many, many, many needs. And so maybe it's all of our sort of departments, if you will, of the legal services, the case management, the therapy, the nurse care management are all working with Teresa. So that the 250 to 280 clients, are not every client is the same, right? So some get relatively little and some get a full array of services. But you're absolutely right. That is a drop in the bucket compared to the numbers that Alex shared at the very opening. So there's a lot to be done, and we work very closely with the Mayor's Office of Neighborhood Safety and Engagement to be working with other organizations in the city to try to work more efficiently, not only with the sort of systems players of the police and the state's attorney's office, but also with each other. As Alex said from at the outset, ROAR is very committed to being accessible to anybody, whether they've reported to the police or not. So we are unique in some regards, because obviously if you haven't reported to the police aren't going to do anything for you. And of course, the case isn't going to wind up at the prosecutor's office. So we really see that as honestly one of the biggest gaps is what is available to folks who have been impacted by crime or violence, who don't, for a whole host of reasons, some of which Alex touched on, don't want to report to the police. So that's, again, yes, there's far more need than there is our capacity for our 12, soon to be 20 people to address. So there's lots of interest and desire for us to improve our systems so that some of the more governmental systems can hopefully provide more trusting services. There's a lot of distrust, as we hear a lot about, between Baltimore Police Department and members of the community. So what can we do to repair some of that? What kinds of alternatives can we create to the police being the only first point of contact? How can we have alternatives that aren't relying only on ROAR, but on other sort of more operationalized citywide responses that don't require reporting to the police? So there's a lot of work to be done, but I am optimistic that there's a lot of political will for some of those changes to take place.
Seems like trust is really critical here. And I guess one of the nice parts about word of mouth is that people who talk about you obviously have built some trust up in you. I'm just thinking about if you've had someone injured in your family and you don't know what happened to the perpetrator. Was someone identified? Was one pursued, convicted, or whatever? I guess that must be really important in terms of coming to closure with some of these feelings that people might be having that contact you.
Definitely with feelings, and also, to be quite candid, with their own not unjustifiable fear. There's a lot of concerns, and justifiably so, for if my family member was killed, is that person also going to harm me? There is a very strong no snitch culture in Baltimore City. Again, not unique to Baltimore. This is true in many cities across the country. So if I'm Teresa and my son's been murdered, and I have talked to the police about what I know, there are lots of reasons to believe, if that is known, that I'm cooperating with the police, and that can be perceived by something as simple as police cars outside of my house, that I may now be at risk of harm. So we get a lot of people in that scenario who are fearful and they want to move. They want to go someplace where they can't be found, or where they feel safer. And of course, that moving like that is often very, very challenging, not least of which by financial ability, right? It costs money to move. And if you're living in public housing, obviously by definition, that means you're low income. There's an 11,000 person wait list to move in the Baltimore City public housing.
Wow.
So, good luck getting a new unit. If you are a voucher holder, often referred to as a Section 8 voucher, that's a voucher that is attached to your property that you are renting, and you can't just up and move. There's a whole bureaucratic process you would have to go through to get that voucher for a new property, and you're in a lease, so you have to break that lease. So there's lots of barriers on, not intentional barriers, of course, but the reality is it's not just as simple as you don't feel safe where you are, you're going to pack your bags and you're going to be somewhere else. You're going to have to, if your kids are in school, you got to find a neighborhood where do you feel good about that other school? You have to re-enroll them. I mean, there's just so many steps. And again, oftentimes when people are in a moment of trauma, grief, loss, and it is all can feel very overwhelming.
Yeah. Well, you probably heard the news this morning because before the legislature, there was some discussion about someone could be released on bail, and the police and others wouldn't be notified of that. And I could imagine how scary that would be if you were a victim.
Absolutely. Absolutely. Particularly if you are, the vast majority of crimes are between people who know each other. That's not often the message that we hear. We sort of are fearful of the person in the parking garage or the person in the bush. But actually it's often much more frequently that it's between people who know each other. So they may know where you live, right? Like particularly if it's intimate partner violence, if it's somebody who been married or you dated or you have children together, but they know where you live. But even with sexual assault and gun violence, it is often within circles of at least acquaintance. So yes, it can be very, very terrifying to not know whether someone's been released, and to not know where they are, right? Like it's not only are they not contained, but they could literally be right outside my door. So yeah, there's again lots of ways in which we heard Mayor Scott address the fact that the jail is not administered by a city agency is part of what creates this disconnect of communication. And so there's lots of things like that in Baltimore City, candidly, because of structural racism and lots of ways in which the city has been, as a majority African American city, has really been hampered in its ability to best serve folks because of the legacy of racism, of redlining, of deeply entrenched poverty, and all of that also places people at greater risk of being victimized. Because candidly, I know that the BPD closure rate on homicides went up slightly in 2021 from about 34% to the low 40s, but that's still pretty low. When you have a 60% chance of never being caught for a homicide, and the shooting closure rate is even significantly lower. It was around 10, I think it's now around 20. But again, that's a 90 or 80% chance of never being apprehended for shooting someone.
Right. Scary numbers they are. Scary numbers. Alex, I see you've got one or two questions, and I just want to remind the participants to get your questions into Alex so we can get them in front of Lydia. So Alex, please.
We actually have a few more. They come in different ways sometimes, but let's bring in your dean, Donald Tobin. Donald, are you there?
I hope I am. Am I?
Yes, you are. Go ahead.
Great. Well, thank you. And thank you to Lydia for all the great work you're doing. I wanted to flip it up and have a question for Dr. Jarrell. When we were looking at putting this together and trying to figure out if it's something that a law school could actually take on, you were like the person who was like, go for it. You need to do this. You need to figure out how to make it work. And it was a little outside of our comfort zone. So why is it that you thought that this was such an important thing for UMB to take on?
Thanks for that question, Donald. And I think my comment back to you would be along several lines. First of all, one of the things that Lydia mentioned was service to the community. And in fact, this is a tremendous service to the community in an area of tremendous need. And I'm sure, like you, I sit around and I hear the news every day and I hear about all of the violence going on. And I know what effect it would have on me as a person if someone in my family or whatever was injured, killed, or whatever. So I think UMB is about service to the community. And we have such wonderful schools here, all with deep expertise. And your school included, of course. And so, one, there was a service component to me that was entirely appealing to me. Second of all, I'll be honest, I hadn't heard of Department of Justice grants. I thought of Department of Justice in terms of restraining orders or whatever you call all of those things that you all do. And to know that they actually had this, what I'm going to call human side, was very, very appealing and funding. And for the audience, what Dean Tobin didn't mention is although they fund this, they don't fund it the way we're used to having things funded. They fund it really almost at the direct expense level. So we as a university have to figure out, and you as a law school have to figure out how we're going to do this and make it financially viable as well. But having DOJ support, I thought was really important. And third of all, this is kind of an activity that's not the usual law school activity. And again, I don't know the world of law schools as much as the two of you do, but I just see this as a dimension to our school that is additive in many ways. So to me, it enriches our environment. And of course, we haven't asked Lydia yet, so maybe I'll ask it indirectly, and that is, what is the participation of our students in these kinds of programs? Because how do you get involved in something like that? Well, if you've got it in your own backyard, it's an opportunity. So I really saw it through many different lenses as being an advantage. So maybe, Lydia, how many students do you involve in all of this?
Sure. Well, that initial VOCA grant that we mentioned that Donald secured also funds 2 positions in the clinical program at the law school. So it created the, oh gosh, I'm going to get the name wrong, Donald, you're going to have to help me out. The Justice for Victims of Crime Clinic, I believe it's what it's called, and then also a staff attorney in the gender-based violence clinic. So through the traditional clinical programs, there were additional opportunities created with this grant. So students that are enrolled in either of those clinics are going to get, get exposure to the type of legal work that we do here at ROAR and be able to be student attorneys representing clients in those proceedings, which was honestly a seminal moment of my own legal career, was participating in the clinical program. So it's one of the things that's very unique about Carey Law is it's required of all of the students to have that practical experience. And then in terms of interns, we do have law school interns. We have usually about 3 every semester, a little bit more in the summer, up to 6 in the summer. And then we also typically have at least one social work doing their clinical placement at ROAR. We haven't had any this calendar year just because, or I'm sorry, this school year, because of we're doing so much growth right now that it was a little bit hard, but typically we also have at least one social work student doing a clinical placement here. We haven't yet figured out, we've been in conversations with the Community Engagement Center and the nurse that's employed there. Our nurse is a nurse care manager, and she is very excited and adamant of exposing other nursing students to that sort of branch of the profession. It's a little different than I think what most people think of as nursing. And then we certainly interface with some of the other schools, what usually around a particular client. So the School of Dentistry, when we have clients that are needing dental work done, some of the clinics at the School of Medicine, particularly around some clients that have had psychiatric disorders that they need some treatment for. And then of course we interface a lot with UMS and with shock trauma as one of the hospitals from which we get referrals.
Yeah, and it points out another thing that I would respond to Dean Tobin about, as well as Lydia, is this is one of many efforts. And, on one hand, a hallmark of this university is that we address a lot of social issues and problems and service to people. At the same time, we never seem to quite get it coordinated. And I know there's 2 human trafficking efforts, one in social work, one in the graduate school. There are a number of things in the Department of Psychiatry. We have Community Engagement Center. We have shock trauma with another program. And undoubtedly, there are many other programs that I do not know about. And one would hope that one day in the future, these things would have a common link that ties them together, still supports their creativity in getting funding and the program, but at the same time coordinates certain things, because all of these things, in my opinion, are linked in some way. But Dean Tobin, did we get to your question or not?
Oh, he's muted himself already, so.
Oh, he's muted himself.
I think you did. Yeah, I think you did.
Okay, well, good. Alex?
Well, I want to bring in someone else who deals with family support issues in Baltimore. Kate Jakuta is on the line, I think, and she has questions that about even more difficulties that people face. Kate, are you there?
Yeah, hi, thank you so much.
Sure.
So I'm in the School of Social Work, and both at my field placement, but also at my job, I work with a lot of immigrant families, and a lot of times the family members are undocumented. So I heard you talk about that before because we know that they are very vulnerable to being victims of crime. Can you describe how you serve this population, especially given the fact that a lot of them might not speak English or have health insurance? And then I was also just curious how I can refer clients to you.
Yeah, absolutely. So yeah, we don't bill insurance currently, so all of our services are free. So the fact that for anybody, if they don't have insurance, that is not a barrier. We are in the process of hiring a bilingual paralegal, Spanish English speaking. But right now, though, we do have significant language capacity on staff. We have we have one native French speaker, one native Arabic speaker, a Nepalese speaker, and a German speaker. We did have somebody who's Spanish speaking, but she was a fellow and her fellowship ended. But we do also have both a language line account and there's an organization that's based in DC. It's called AUDA, and they have a language database that we also have access to both for interpreters and translation of documents. So that's how we're able to serve non-English speakers. In the past, we were also able to help with any legal documentation issues that folks may be eligible for. So there are a few unique ways that somebody who's undocumented could achieve documentation status if they are a victim of crime. One is through what's called a T visa, which is if they're a victim of trafficking. Another is a U visa if they're a victim of crime. A third is if they're married to a U.S. citizen or legal permanent resident and would be otherwise eligible to be sponsored for citizenship and they have experienced intimate partner violence. They can what's called self-petition without the spouse's cooperation. And so we did do those cases. That same fellow who was Spanish speaking was the one who did that. So so currently we work with other legal providers in the city that do that immigration work. And we don't have anyone on staff who has that expertise at the moment, but we're hoping to build that expertise with time. So that was a very long way of saying we do have language capacity and we do work very much with folks that have those legal issues we don't just refer them to other service providers. We really do what's called what we refer to as a red carpet referral, where it's really a very intensive walking with survivors to help them find that lawyer that could help. In terms of referring folks to us, our intake line is 410-706-2781. So if you're on campus, it's just the last 5 digits, but again, it's 410-706-2781. That is not a staffed intake line, so somebody could leave a message. And then our intake person would call back. So if somebody is non-English speaking, that our intake worker would call back either with the AT&T language line or a translator from AUDA's service so that they can communicate in their native language. If somebody wanted to schedule an appointment, particularly if language or if they're already working with you and doing that kind of phone tag is difficult, then we do over email schedule special intakes when there's another provider that's involved. So I'd be more than happy to provide that email address if that's helpful, but or you can just reach out to me directly and I'd be happy to give you that person's email address.
One of the wonderful things about our law school is the clinics that it has. And one of the clinics that we have now is we have an endowed immigration program that Professor Maureen Sweeney leads, and which was endowed by a graduate of the university, Dr. and Mrs. Marco Chacon. And there's a whole lot of capability in that clinic as well as other clinics in the law school. So I would get acquainted with those if you're dealing with those kinds of clients. Thank you for that question. Alex?
Well, recently we had one of Kate's colleagues at the School of Social Work, Kyla Liggett Creel, on the program talking about, how the impact, how things like not just violence, but other things impact the whole community, not just the people they occur to. We've had a number of people who have asked a similar question. So I'm going to bring in Vincent Conroy. Vincent, go ahead and ask your question.
Okay, thanks. Thanks for the talk. It's been a wealth of information. I appreciate all the efforts you put forth. I was just curious if the Roar Center is able to assist individuals who have witnessed violence and have been traumatized by it, and that would extend to even folks within the campus communities, faculty, staff, students, beyond the local citizens and neighbors.
So thank you for that question. I would have said yes, absolutely, because we certainly recognize that the trauma for folks that have witnessed a crime or violence is significant. Unfortunately, because the demand for our services so quickly outstripped our capacity, that we now are limiting our services to those who have been directly impacted. And it's a little bit of a fuzzy line, right? Because obviously, if I witness a family member be killed, I am considered the victim under all of our justice systems. I'm referred to as a homicide victim, a homicide survivor. Excuse me. The victim is obviously the person who's deceased. And so it's a little bit of a fuzzy line, but the short answer is we provide referrals when we can, particularly for the counseling piece. We are in the process of hiring our second therapist, but we only have one currently. And as one can imagine, the demand for her services has been very, very severe. The one additional add to that is that we do have two groups operating at the moment. One is called the Peer Healing Circle, and it is specifically for Black men who have been non-fatally shot in Baltimore City. The other is for women who have been non-fatally shot. And so we do hope, the relevance of that in relation to this question is that we're hoping to build out more groups, and the next group will probably be mothers or direct family members of homicide victims. And then beyond that, we are thinking, because we do get so many requests for other people impacted, whether it's witnesses or sort of like next circle out of family, if you will. So not a mother or a sibling, but cousins or aunts and uncles, that we are hoping in time that we'll be able to build out groups and really pulling from the wisdom of the community, because unfortunately, there's so many people in the community that have been impacted by this. So we're really building a peer support model so that it isn't always our staff that would be providing that. We would be providing the training, kind of what Kyla Liggett Creel has been doing so beautifully throughout the city of developing that peer model. We really learned a lot from Dr. Kay, as she's known in the city, about how to do that well.
Good question, Vincent. And the other thing I would add is that our School of Social Work and School of Medicine, I believe that was the two combinations, did a study post Freddie Gray, the Freddie Gray murder, and found that the number of depressive symptoms in young mothers, a tremendous toll, unmeasured, in terms of impact on the community. So it's really a broad question. Obviously, Lydia's program can't address them all, but they're all out there for us to try to do something about. So that was another, and I don't remember the exact name of the program, the study, but it was published, I'm sure of that. Alex?
I was going to mention that Vincent wrote in the chat, I'm sitting at the CEC with students who participate in the UMB Health Alliance, which is the group I was referring to. We all thank you for your response, and please use us as a resource if we can assist. We have a number of anonymous questions, including if you have any success stories that, without revealing anyone's personal information, of course. Is there anything that jumps out at you as, wow, we really helped someone there?
There's so many actually, but I'll use one of our early clients who came to us. He's a veteran of the Vietnam War, he was actually injured and discharged, had a medical discharge, but he was injured stateside. And it was a somewhat of an unusual accident that happened. He was on base in DC and was hit by lightning. And the relevance of that is that he was often up against lots of bureaucratic barriers because it kept being deemed as not service-related disability, which is a whole area of law that I know more about than I ever wanted to about being eligible for veterans benefits. As a result of those barriers, he had cycled in and out of homelessness for much of the ensuing decades since his discharge. So he was now, in his mid to late 60s. He had 3 children who were all adult children, and he had also recently been diagnosed with cancer. So he had a lot of challenges. And the reason he was referred to ROAR was because he had been renting out rooms in his apartment to people in the community because he had been rehoused under a benefit that is available to veterans, but into a place that was 3 bedrooms, even though he's a single man with no dependents. And with the voucher, he was able to make the rent, but without the voucher, once the voucher, it was a temporary supplement that he was given towards his rent, he could no longer afford the rent for a 3-bedroom apartment. So he was renting out rooms, and there were 2 women renting different rooms in the house, and they were stealing from him, and they were physically assaulting him when his benefits checks would come in the mail to steal his money, basically. And when he went to the police to report this, the police kept saying, well, there's really nothing we can do. You can go to the commissioner's office. And he was really in a very tough spot. He didn't feel safe at home. He was trying to manage his cancer treatment. And so, again, it was one of those situations where all of ROAR's services came to bear. The nurse who was able to connect him to providers that were closer to a new apartment that we were able to get him. That was in a community that was all older folks and predominantly veterans. So he was within a community that he really had a lot of kinship with. And then the legal issues with his veteran benefits that they've been underpaying for all of these decades. And so we were able to get an adjustment to his disability rating, which also increased his benefits. And he, before the pandemic, would stop by because he would get his medical care across the street at the VA. So when he was there, he would come over and he just filled the room with light and positivity and was just so grateful for all of the ways in which things he had been struggling with literally since the 70s that had really impacted his ability to remain housed. He really felt like he had a champion and with everybody at ROAR. So that's one story that immediately comes to mind. But there are so many and so many folks that have been impacted by gun violence where they really feel as if the systems treat them as if they have done something wrong and not as if they are a victim of crime. And so one of the things that I really impress upon everybody who works and volunteers at ROAR, whether they're students or staff or other, is how treating people with dignity and respect is at the very core of our work. And that is as simple as what I think of as good customer service, right? That you answer people's phone calls, you return them as quickly as possible, that you sit with them and you hold space for whatever they're going through that day. You really meet people where they are, and just what a magnitude of difference that is from the experience that many people have, interacting with other systems where they again often feel like, why am I the one being interrogated? I'm the one that just got shot. Why are the police acting as if I'm the one who has done something wrong? Why is my phone being taken? Why am I shackled to a bed when I'm here in the hospital? So we're really trying to work with our partners around, both on campus as well as throughout the city, to really shift that narrative and shift that frame in which folks in Baltimore City are seen. And again, it is, we're in a predominantly Black city, and then our clients are predominantly Black and predominantly lower income, and all of the ways in which systems don't see them as fully human and as deserving of respect and empathy and care. And so we really are very, very focused on shifting that and making sure that they know this is a safe place to come. We have not seen people in person since the pandemic. We're still operating entirely remotely, but I hope one day soon that we'll be able to welcome the community back in, literally, as well as through the video cameras and telephones that we've been doing for the past 2 years.
Great, thanks. Alex?
I just want to mention this because I'm always amazed by things that I see. You never know who's watching this program. So we have a viewer in Zambia. Mutinta Chalonzia is watching us from Zambia, and so you never know where you're going to pop up. We do have more questions.
Welcome, welcome.
Exactly, that's fantastic. I thought that should be honored. So, has your caseload changed during the pandemic? And I realize you only started a year before the pandemic hit, and you may not have as good a read on that, but what's your sense?
Yeah, no, it went up astronomically. The first few weeks of the shutdown, we saw a slight dip, and I think that that was true for many, many organizations. I think, candidly, because everybody was just like freaked out and hunkered down at home. But about 3 weeks after the initial shutdown, our numbers spiked. And in October of 2020, we had a 300% increase in just that 1 month over what had been pre-pandemic. So again, the requests for assistance far outstripped our capacity to meet those requests. Some of that was clients that had been stabilized, that had come to us prior to the pandemic, were now destabilized by loss of job, being sick, children being at home, all of the things that the whole world experienced had a particularly difficult impact on those that were already very vulnerable. So a lot of folks were coming back to us of needing more assistance. We also were lucky to get some monies from the governor's office specific to COVID relief. How we use that money was in being able to make payments directly for survivors of crime to meet some needs that that we all need, right? Cell phones, unfortunately, those have become a necessity, right? Particularly if you're looking for work, you can't be without a cell phone. So paying people's cell phone bills, paying back rent, they had lost their job and were at risk of course, evictions were on hold, but wanting to keep people as stable as possible in their housing, paying utility bills. We are very, very focused on making sure that folks are availing themselves of benefits and services that already exist. We don't want to duplicate, but if either they had exhausted those other benefits or weren't eligible, we had this additional fund, and we still have able to successfully fundraise to replenish that money. And so that was the number one additional need that we saw because of COVID, was really that financial insecurity.
Lydia, one thing I want to make sure you mention to the audience, and that is that you did get a portion of the mayor's office neighborhood safety and engagement grant. Could you just mention sort of what that is, and also sort of your view of the attention that the city is giving to this problem?
Yeah, absolutely. Well, of course, Mayor Scott has a very comprehensive crime prevention plan that he has promulgated more than a year ago, or about a year ago. And so the way in which ROAR fits into that plan is in many different aspects, but the investment that MONSE, as the Mayor's Office of Neighborhood Safety and Engagement is known, the investment they made in ROAR is really around the work we do with gun violence survivors. There are so few resources available to folks that have been shot other than the hospital responses. So once somebody is discharged, there is, of course, the continuity of care that any medical provider has, but there's often people disconnect. And in part that can be because, the hospital was where they were brought on probably the worst day of their life, right? And they don't necessarily want to come back to or to Bayview or wherever else they were brought in the city immediately after the shooting. Again, as I already mentioned, it's a complex system of referrals and, keeping track of multiple different locations. I have to go to this place for pain management, a different place for this, third place for another. So given that we have the broad array of services that really meet the needs of gun violence survivors, and we have that peer healing circle that I mentioned earlier, which I didn't really talk about, but I'll just briefly say is facilitated by 3 Black men. One who's a licensed clinical social worker. One is a survivor of violence himself, who worked as a violence interventionist in Sturgis County in DC, and then Leonard Spain, who's a violence interventionist and a survivor of violence here in Baltimore City. So the 3 of them lead the peer healing circle, but again, it's very much peer driven. That we are piloting projects like that, and another one for the female survivors. All of that is what Monse was really recognizing as being a critical need for the city and being unique and distinct from other services that are provided. So we do work very closely with Monse and other Monse grantees. Again, there's a lot of work that Mayor Scott has tasked Monse with. So we're not all the way there yet, but we're definitely working in collaboration with many pieces of that plan.
Alex, we got time for maybe one more question. Do you have another one there, sir?
We got a bunch more, but I'm gonna bring in Tricia O'Neill, who's actually has a question that several people have asked. Go ahead, Tricia.
I know the campus charity campaign just wrapped up, but I'd like to ask Lydia, who has worked with me on something for which I was very appreciative, how we might donate if people are motivated to support their wonderful efforts with our own dollars.
Thank you, Tricia. Nice to hear from you. So there is a way, and I'm not going to be the best person to tell you that way, but there is a website that has multiple programs of the law school. So there is an online giving portal that one can make a donation and designate. It's making it to the University of Maryland Foundation, but you can designate it specifically to ROAR. What that website is, I'm not positive, so I will certainly let you know, Tricia. But yeah, that is something that I should know at the drop of a hat. But yes, there is a way to give a donation to the foundation and designate it specifically if you are so inclined.
Okay, Alex, we still got a minute or two. Since
You
Tricia
posted
was
the address
to
in the chat.
Yeah, well, okay, I'll put that out there. I don't know. I'm going to try to combine 2 questions, but I hope you have enough time to answer. One is, why is there so much stuff that victims have to go through, bureaucracy, after they're victimized? And the other is, don't the police have people who help victims after they filed a report?
So yeah, I wish I had an answer to the first question. I don't think it's by design. I would hope it's not by design. I think it is really a function of our legal system, where a victim is not a party to the case in a criminal matter. It is the state of Maryland or the United States, if it's a federal crime, versus the person who caused the harm. And so the person who's impacted by the harm literally doesn't have a role to play other than a very critical witness. Victim witness is literally how they're referred to, if and when that case goes to prosecution. So all of those bureaucracies, I think, are an outgrowth of that reality that in the criminal system, it is the government versus the individual who caused the harm. And I'm sorry, Alex, the second question was...
Don't the police have people who can help with that? And that wasn't a person wasn't trying to be funny, but I mean, that's...
No, I
you would
know.
think that would be a
question. So yes, there's a fairly recent addition to Baltimore Police Department that originally they were only homicide advocates, so it was to bridge that gap between the detectives investigating homicides and the family members that were left behind. They have just recently expanded, like within the last 6 months, to also include non-fatal gunshots. The issue, again, is a very bureaucratic one, is that the police are not, they have their whole system and culture of information that they share, and it hasn't yet yielded sort of information freely to the person impacted. Other than that, it's a little shocking, but there really isn't a lot of support. There are, like if you see Law and Order, it sort of seems like everything's, like everyone's kind of there for the victim and it's all wrapped up neatly in an hour. And unfortunately, if I had much more time, I would disabuse you of that perception. It is a lengthy process and one in which sadly the victim is often feels very sidelined, and that is the reason among many that ROAR exists.
Well, we'll
I
have
know
to-
we're out of time. I just want to interject because, you know, Tricia knows, I think knows everything that goes on at campus. She points out our police have a victim witness coordinator that helps people, even if the crime is in a different county. So I don't know how to contact them, but if you're interested, you might contact our police. She says, I know in the past they've driven people to court, stayed with them. It sounds wonderful. So
So
And
Lydia, great time, great things for you that you're doing, and it was really good to learn about it. I look forward to a follow-up a year or two from now to hear how you've done and helped make this city a better city to be in. So thank you for being with us. Thank you to the participants. We'll see you the next time.